Hello everybody, we're Rachel, Lindsay, and Jackie, and we're nursing students at BYU Idaho in Rexburg, Idaho. Today we'll be talking about type 2 diabetes. Diabetes is a lifelong chronic condition that must be managed, but for those who have been diagnosed, it does not have to be scary if you are informed and know how to take control of your body. Let's get started. Diabetes can also be known as diabetes mellitus. There are two types of diabetes, type 1 and type 2. In this presentation, we'll be talking about the difference between type 1 and type 2 diabetes, risk factors for obtaining type 2 diabetes, how to prevent diabetes, what it means to be pre-diabetic, how to recognize the symptoms of diabetes, testing your blood sugar, giving insulin, and potential complications of unmanaged type 2 diabetes. In order to understand that type 2 diabetes can be prevented, we first need to understand the difference between type 1 and type 2 diabetes. Type 1 diabetes is also known as juvenile diabetes. This is because it is an autoimmune disease that often appears during childhood or the teenage years. Children diagnosed with type 1 diabetes can live long, healthy lives as long as they monitor their blood sugars and keep them in range. Type 1 diabetes is different from type 2 in that type 1 diabetic's pancreas doesn't make beta cells that regularly produce insulin. Type 2 diabetes is the most common form of diabetes. It is also called adult onset diabetes because it manifests itself in older age. When your body has type 2 diabetes, this means that your pancreas is making insulin, but your body is not using it properly. Type 2 diabetes often occurs in adults who are sedentary and overweight.
Nearly 30 million Americans have diabetes, but over 8 million of them are unaware of their condition. There are certain risk factors that contribute to a person developing diabetes type 2. There are non-modifiable risk factors. This means that these risk factors are out of the person's control, such as a family history of diabetes, their age, because your chances of developing diabetes increases after age 45, certain ethnic groups such as African, American Indian, Asian, Hispanic, Latino, or Pacific Islander are at a higher risk, and gender, because men are at a slightly higher risk for developing diabetes. There are also modifiable risk factors. This means that they can be changed, such as being overweight, living a sedentary lifestyle, having high blood pressure or high cholesterol, and having a poor diet. Next, we will discuss how to begin to change these modifiable risk factors. Eating well is crucial when you have diabetes because what you eat affects your blood sugar. No foods are strictly off limits, though. Focus on eating only as much as your body needs. Remember to eat plenty of vegetables, fruits, and whole grains, and to choose water over regular soda or sweet tea. Limit your intake of sugar and fat. Choose non-fat dairy and lean meats, and remember that carbohydrates turn into sugar, so watch your carb intake. Now we're going to talk about myths and facts about diabetes and diet. A common myth is that you must avoid sugar at all cost. The fact is that you can actually enjoy your favorite treats as long as you plan properly and limit those hidden sugars in many packaged foods. Dessert doesn't have to be off limits, as long as it's part of a healthy meal plan or combined with exercise. Another myth is that you have to cut way down on carbs. The key is to eat a balanced diet. The serving size and the type of carbohydrates you eat are especially important. Focus on whole grain carbs, like whole wheat bread or brown rice, since these are a good source of fiber and they are digested slowly, keeping your blood sugar levels more even. On your meal plate, keep 1/2 of it non-starchy vegetables, such as broccoli and green beans. Another 1/4 should be your whole grain carbs, and the last 1/4 should be lean meats or proteins like beans. The last myth is that you'll no longer be able to eat normally, that you need a special diabetic meal. The fact is that the principle of healthy eating are the same, whether or not you're trying to prevent or control diabetes. You can easily eat with your family and friends if you eat in moderation.
Along with proper nutrition, exercise is a key factor for preventing and controlling diabetes. Exercise is good for everyone. Some people think that if they have to lose weight, it has to be a lot. For many, the idea of dropping 100 pounds sounds daunting. That even sounds daunting to me. But in this case, it's proven that just losing 10 to 15 pounds will make a big difference and help improve your lifestyle. Some of the benefits of exercise include that it lowers blood sugar, lowers blood pressure, lowers the bad cholesterol while raising good cholesterol, assists in losing weight, and lowers stress levels. Some people might wonder what a good exercise program even looks like. What should I be doing? Well, a good exercise program does not have to be difficult. The best place to start is just to be consistent. Start with small goals and work your way up. For example, decide you're going to exercise every Monday, Wednesday, and Friday for 30 minutes each day. If you set small goals like that at first, you will see it's easier to set further, more challenging goals. Whatever you choose to do, be consistent and don't miss a day in your plan. Next, your exercise program should get your heart rate up, but it should not leave you very out of breath and discouraged. Push yourself, but not too hard. Remember, we're mainly looking for consistency. One of the most important things to remember about exercising is to pick something you actually like doing. For example, I personally hate running. Some people love it, but I would much rather prefer to ride a bike 5 miles than to even run 1 mile. That's totally okay. Find what works for you. Participating in exercise activities that you enjoy will also make it easier for you to stay motivated and stick to your plan. Try to incorporate a warm-up and a cool-down into your exercise routines. Walking and stretching are good warm-up and cool-down exercises. Some ideas for exercises to try include walking, jogging, biking, weightlifting, dancing, swimming, or hiking.
Now that we've talked about tips and ideas for healthy living that will give you the best chance of preventing diabetes, we're going to talk about what to do if you become diagnosed with prediabetes or diabetes. This picture shows that a normal blood sugar range is 70 to 100. It is not considered diabetes until 126 or higher. If your blood sugar is between 100 to 126, you are considered a pre-diabetic. There are 79 million Americans who are pre-diabetic. The American Diabetes Association recommends screening for all adults 45 years old and older. When you are pre-diabetic, your blood sugar level is above normal, but you do not yet have the disease. To keep it that way, take action and manage your condition. Talk to your healthcare provider to make a plan. In general, changing the way you eat and increasing your activity level to at least 30 minutes of exercise a day will help you. A complete lifestyle change will have a positive impact on your whole life.
It is important to remember that type 2 diabetes develops slowly. That is why it is so important to engage in preventative measures in an effort to delay or eliminate the progression of the disease. As we've talked about up until this point, type 2 diabetes can be prevented. However, if you notice that you are having some of the following symptoms, it is important to talk with your doctor and to be tested for diabetes. The presenting symptoms for diabetes result because of hyperglycemia or high blood sugar. Some of the symptoms of type 2 diabetes include increased thirst. This occurs because your body's cells and tissues have less water in them. You are dehydrated because the water that is in your body is being used to dilute the excess sugar in your blood. Thus, your body thinks it needs more water, which it actually does, to continue to dilute the sugar in your blood. Increased urination occurs because you are drinking more water. More water equals more urination. Increased hunger. Your body's tissues aren't getting the nutrients they need because the cells aren't taking in the sugar from your blood like they should be. If you have diabetes, after you eat a meal, it is common to continue to feel hungry. Fatigue. Similar to increased hunger, your body simply isn't getting the nutrients it needs, causing you to have decreased energy and to feel tired. Poor wound healing. Having high blood sugar levels negatively affects your body's ability to heal wounds. Sugar interferes with the body's natural immune response. One woman didn't know she was diabetic until she was admitted to the hospital with a severe burn to her foot that would not heal. After the doctor recognized that it was taking a very long time for her wound to heal, he tested her for diabetes and found that her blood sugar levels were above 500, and she was promptly diagnosed. Blurred vision. The fluid in your body is all trying to assist in the dilution of the extra sugar in your blood. So even the fluid from the eyes is being pulled to help dilute the glucose, causing blurry vision. And lastly, fruity breath. Your breath could often smell fruity, but this is just a result from the extra sugar in your body. When a medical professional suspects you have diabetes, testing will be done to confirm the diagnosis. A common test done is a fasting blood glucose test, which checks your blood sugar after you haven't eaten anything for 8 hours. If the results are greater than 126, like Rachel told us about earlier, diabetes will be diagnosed. Your doctor could also choose to use other tests to diagnose diabetes, such as an A1C or an oral glucose tolerance test.
To test your blood sugar, it requires a small prick on your finger with a tiny needle. The small drop of blood that is produced is read in a meter and will tell you what your blood sugar is. Your doctor can test your blood for your blood sugar level. If you are a diabetic, you may be testing your blood sugar yourself at your home with your own kit. Either way, it is not difficult to do and does not have to hurt. It is important to keep a record of your blood sugar readings. Remember, your blood sugar is normal if it reads less than 100. You are considered pre-diabetic if your blood sugar is 100 to 125, and if it is 126 or higher, then you are considered to have diabetes. Now we are going to teach you how to test your own blood sugar at home with the kit. First, gather your supplies. You will need the meter and the test strip to read the drop of blood. You will also need the device to prick your finger along with the tiny needle that goes into it. You may want to have a Band-Aid or a cotton swab nearby to apply pressure after you have pricked your finger and have completed the test. Now it is time to wash your hands with warm soapy water. After your hands are washed, you can place a test strip into the meter. Now choose a finger that you will prick. It is best to alternate between fingers and the site that you choose to prick to avoid your fingers feeling sore or bruised. Next, you will use the device to prick the side of one finger by pushing the trigger on the end. Squeeze your finger some to produce a drop of blood for the test strip to read. Gently touch the test strip to the drop of blood. The test strip will automatically pick up enough blood. All you have to do now is wait for the meter to read it and tell you the results of your blood sugar level. If your blood sugar level is less than 70, call your doctor. If your blood sugar level is greater than 160 for more than a week, or if it is 300 or greater, also call your doctor. Now we will talk about medications to help control blood sugar levels. Some of you may notice a family member who is diabetic, but does not have to take any insulin. This is because there are medications that can be taken in pill form to help lower your blood sugar levels. Some examples are metformin and glipizide. If you take a look at the pie chart, you'll notice that it says a majority of people with diabetes only take oral medications. There are also insulin injections to help control blood sugar levels. In this presentation, we will not go into depth about the different types of insulin, but we will discuss giving self-injections of insulin. Remember, these medications do not cure diabetes, but will help control it.
Some people think they could never grasp the idea of giving themselves shots. However, the needle for insulin injections is actually really small, not anything like getting a flu shot or immunization. The needle only inserts into the fat layer, not all the way down to the muscle. Here are the important steps for giving a self-insulin injection. First, select an injection site. This can either be the abdomen, arm, buttocks, or leg. Remember to rotate injection sites each time to avoid soreness and bruising. Using the same injection site also causes the tissue to become scarred and decreases insulin absorption rates. Next, hold the syringe like a pencil. Gently pinch 2 to 3 inches of skin and quickly dart the needle into the skin at a 90-degree angle. Release the pinch. Push down on the plunger to inject the insulin. After the insulin has been injected, pull the needle straight out quickly. You may or may not bleed after the injection. If you are bleeding, cover the injection site with a bandage if necessary, but remember never to rub the injection site.
Someone may say, I've noticed that some diabetics take both pills and insulin. Is this possible? The answer is yes. There is a treatment that combines the two. When taken as directed by your doctor, it is very safe and effective in controlling your blood sugar levels. Combination therapies are often helpful for people who have type 2 diabetes. If you have been taking an oral medication, your doctor may change your treatment plan to include insulin injections. This change is often made to help people with type 2 diabetes gain better control of their blood sugar. Remember, if you are taking oral medication or insulin injections, you must be testing your blood sugar regularly before meals, at bedtime, and when you wake up in the morning.
Having low blood sugar is called hypoglycemia. Hypo means low, and glycemia is sugar. When you are experiencing low blood sugar, you may experience feelings of anxiety, dizziness, hunger, shakiness, feeling sweaty, but having cold and clammy skin, being irritable, having heart palpitations, and just having an overall feeling of confusion and difficulty concentrating. If you are diabetic and are experiencing these symptoms, you should not ignore them. Ignoring the signs and letting your blood sugar drop even lower could result in coma, seizures, or death. If you fear that your blood sugar is too low, get your blood sugar meter and test your sugar levels. Your blood sugar levels can be considered low when the number falls below 70. Once you discover you are having a low blood sugar episode, the best thing to do is eat food that will raise your blood sugar. Many people think that candy is a good source of sugar and therefore will do the job. However, because you want to raise your blood sugar and keep it raised, you need to remember to have sugar plus a protein. Some good sources of sugar to treat low blood sugar could include orange juice, fruit, or honey. Protein sources can be found in milk, cheese, and peanut butter. Some common snacks we have seen repeatedly that treat low blood sugar episodes are peanut butter on crackers with a glass of milk or peanut butter and jelly sandwich. These are just some ideas though. It is a good idea to find snacks that work for you that would be a quick to fix or easy to pack. Some people ask the question, if I am a diabetic and am having problems with my sugar, shouldn't I give myself insulin? This is a very good question, but the answer to it is no. Rachel taught us earlier that the insulin is a medication used to treat high blood sugar. Insulin will lower your blood sugar levels. If you are having a low blood sugar episode and give yourself insulin, the problem will get even worse as your sugar numbers continue to decrease. Some or many of you may have heard of glucagon. Glucagon is a hormone that raises the amount of sugar in the body and is used in only very, very emergent cases of low blood sugar. All diabetics should carry a glucagon pen with them in the event that their blood sugar levels fall so low that they become unconscious or are not able to eat food items to raise their blood sugar.
When diabetes is left uncontrolled, it has the potential to cause other negative effects in the body. As you can see in the picture on the right, there are many effects from diabetes on the body. Some of those major effects include problems with your kidneys, circulatory system, nerves, skin, and eyes. We will briefly go over each of these possible complications more in detail now. Uncontrolled diabetes causes sugar to be present in your blood, which is then filtered by the kidneys. As your kidneys filter the blood to remove the waste products from your body, the extra sugar damages the kidneys. The more damage your kidneys have, the harder it is for the kidneys to filter the waste products from your blood. Diabetic nephropathy is the term used for kidney failure as a side effect of poorly managed type 2 diabetes. You may know some people who have had diabetes for a while and they are now having to start dialysis treatments as they are getting older. When the kidneys start losing function and aren't filtering the toxins from the blood as well as they should be, dialysis, which is when a machine has to filter the blood for you, often becomes routine in the treatment for kidney failure.
Another system that is affected by poorly controlled diabetes is the circulatory system. When too much glucose or sugar is circulating in the blood, fatty deposits can begin to develop on blood vessel walls. These fatty deposits contribute to a disease called atherosclerosis. The picture on the right shows how fatty deposits in the blood vessel can cause problems. The blood vessel on the top is a normal blood vessel, and it's easy to see that the blood can flow freely through the vessel. The middle picture shows what it is like when fatty deposits start forming. The blood is not able to flow as freely. This is also often why diabetics have poor wound healing. Blood carries nutrients and oxygen needed to heal wounds. But when blood flow through arteries is restricted, it takes a lot longer for wounds to heal. Restricted blood flow is also a contributing factor to why diabetics often cannot feel injuries like burns or cuts, particularly on their feet. If blood flow is restricted, the sensation is diminished, and a person may not be able to feel an injury or cut. Sadly, amputations are occasionally a result of unnoticed wounds that turn into gangrene. Lastly, diabetics are at a higher risk of having a stroke, also due to the plaque buildup in arteries of the brain. Similar to circulatory problems causing increased risk of injury, diabetes also causes nervous tissue damage, which can lead to decreased sensation, also causing injuries to go unnoticed. Once again, nerve problems are also caused by prolonged exposure to extra sugar in the blood. Diabetic neuropathy is the term used for the tingling and pain that comes from damaged nerves, particularly in the feet and hands. Many people describe it as a pins and needles feeling that can often be very frustrating to suffer from. Luckily, there are medications that can be taken to help with the tingling and pain. But the best treatment of choice is to prevent this complication by properly controlling diabetes and keeping blood sugar levels within normal range.
Lack of moisture can cause the skin on your feet to dry and crack. Be careful with using creams, especially on your feet. Anything moist left between the toes can cause an infection. Moist, warm folds in the skin are susceptible to fungal or yeast infections. You're most likely to develop this type of infection between fingers and toes, the groin, armpits, or in the corners of your mouth. Symptoms include redness, blistering, and itchiness. High-pressure spots under your foot can lead to calluses. If you don't take good care of them, they can become infected or develop ulcers. If you get an ulcer, see your doctor immediately. This is why it is so important to wear properly fitting shoes and to inspect the bottom of your feet every day for sores, blisters, or redness. If you have poor blood flow, it is especially important to do a daily foot check. Always wear closed-toed shoes or slippers, do not wear sandals, and do not walk barefoot even around the house. Check your toenails once a week. Trim your toenails with the nail clipper straight across. Do not round off the corners of the toenails or cut down on the sides. After clipping, smooth the toenails with an emery board.
Diabetes is the leading cause of blindness for adults ages 20 to 75. High blood sugar causes the lens of the eye to swell, causing a blurring of vision. If you notice you are having blurred vision, do not simply go buy another pair of glasses. The problem could be temporary and could disappear once blood sugar levels are back within normal range. If you notice your eyesight is worsening, however, contact your doctor and schedule an appointment to review your diabetic treatment plan and to get your eyes checked out. Diabetics are also at an increased risk of getting cataracts, glaucoma, and retinopathy. Cataracts are when the lens of the eye becomes cloudy or foggy. As people age, many of them will experience cataracts, but the incidence is higher for diabetics. There is surgery that can be done to remove the cataracts, but could also sometimes lead to other problems for diabetics. To help with mild cataracts, the best treatment is to wear sunglasses often to avoid extra glare from the sun. Glaucoma is a condition where there is increased pressure from the fluid in the eye. This pressure can push on other anatomical features of the eye, such as the retina or optic nerve. When either of these features are damaged, eyesight can be lost. There are treatments that can help with glaucoma, such as medications or surgery. These options should be discussed with your doctor. Diabetic retinopathy is a condition where the retina in the eye is damaged. There are many types of retinopathy, all of which result from blood supply being cut off to the eye. Retinopathy cannot be cured, but it can be prevented and managed.
In conclusion, there are important steps to remember for proper diabetes management. Have an eye exam and a urine test once a year or as recommended by your doctor. Have your cholesterol and triglyceride levels checked once a year, or have a lipid profile test. Have a dental exam every 6 months. If you have any signs of infection, such as a fever, redness, or swelling, call your doctor. Practice good foot and skin care. One thing that you can do is use a mirror to inspect the bottom of your feet daily. Do not smoke, and try to manage stress as best as you can. Continue learning about diabetes to maintain and improve your health. Attend a diabetes class or schedule visits with your doctor. Thank you. We appreciate you for taking the time to watch this presentation.
If you have one more moment, please leave a comment of what you learned or any personal experiences you may have. Thank you so much.